Come in.
Hi, Mr. Van Dow. How are you feeling today?
I'm not feeling too good. I'm just miserable and my body aches.
Everyone that has a pet can tell you how much of a pleasure it is to have an animal as a companion. There is something about spending time with a pet that can lift up a person's spirits, and studies have shown that it can do even more than just that. According to the Encyclopedia of Alternative Medicine, animal-assisted therapy utilizes trained animals and handlers to achieve specific social, cognitive, and emotional goals with patients. The first known account of the therapeutic use of animals occurred in the 9th century in Geel, Belgium. In Geel, animals were included in therapy so people with disabilities could learn to care for farm animals for their daily living. In 1964, an American child psychiatrist named Boren Levison coined the phrase pet therapy. Florence Nightingale has also been credited as a pioneer of animal companion therapy as an aspect of health restoration. In her notes on nursing, she recommends a small pet animal as an excellent companion for the sick. Just as in the past, animal-assisted therapy is being used even today. In recent years, it has been proven that by owning a pet, or just by being around animals, one may enjoy several health benefits, including lowered blood pressure, reduced cholesterol levels, increased life expectancies, among others. Pets may also be able to alert a person to an impending seizure up to an hour before it occurs. Petting an animal in and of itself has been proven to reduce stress, lower heart rates, skin temperature, and anxiety, and improve one's immune system. These are just some of many improvements observed in patients undergoing animal-assisted therapy. Studies have shown that pet owners tend to live longer than non-pet owners. Popular animals used for therapy include the following, with dogs being the most commonly used animals for therapy. Pets play a major part in treatment of patients that have conditions and diseases such as cerebral palsy, Alzheimer's, dementia, and accident victims, to name just a few. In one study, patients that had Alzheimer's were exposed to a pet in the evening hours for an extended amount of time, with results showing that the long-term presence of the dog boosted positive social behaviors among people with Alzheimer's. They also help children take their mind off their problems and sometimes encourage them to open up to a care provider for a discussion. One social worker uses her dog in helping children in preparing for and overcoming the death of a family member. She has also noticed that children feel more comfortable discussing how they feel about the situation and cope better when interacting with a dog. The primary objective of Therapy Dogs International, a national organization dedicated to training dogs and handlers, is for volunteer teams to provide comfort and companionship to patients by sharing the dog wherever it is needed. However, in order for a dog to become a therapy dog, there are a few criteria that the dog has to meet, such as a 1-year-old age minimum and holding a Canine Good Citizen certificate issued by the American Kennel Club. For those interested in volunteering with their dog as a team at VCU Hospital Services, you and your pet can together create a team for Dogs on Call, an animal-assisted therapy program established at MCV. A number of requirements must be met, however. For dogs, the completion of an approved dog therapy program through the Delta Society must be accomplished. Here, dogs will be trained to behave in a certain manner while in the hospital. These behaviors coincide with the Dogs on Call policies and procedures. Volunteers must contact 804-828-0922 to inquire about volunteer requirements and receiving their IDs. Volunteers must also notify the Center for Human-Animal Interaction when all requirements have been met. Some of the behaviors that dogs must be able to do include, but are not limited to, accepting a friendly stranger, accepting petting, sitting on command, react appropriately to distractions, and be able to withstand clumsy petting.
Come in.
Hi, Mr. Van Dow. I have a surprise for you.
Ooh, a puppy.
This is Lily.
Hello.
She's one of our therapy dogs here. I thought that would be nice if they brought her in for you. Sit, Lily.
What a great surprise.
Good morning.